Good afternoon.
Good afternoon.
Mr. Chairman, committee members, staff, my name is Juan D. I'm owner of Harlingen Family Dentistry. Harlingen Family Dentistry is a premier dental practice in the Rio Grande Valley, having practiced for over 31 years. It has become the largest single practice in the state of Texas with over 140 employees in one facility. I was educated at the University of Texas Health Science Center San Antonio and have practiced for our military at Fort Sam Houston. I was appointed to the State Board of Dental Examiners and served from 2001 to 2008. Last year I testified on behalf of Senate Bill 1803. And I was very happy to have the Governor, Perry, sign that into law. Because in 2011 we had a Medicaid payment hold put in our practice by OIG investigation of our orthodontic billings. Only 2 practices so far in the last 3 years have had payment hold hearings before the State Office of Administrative Hearings. That should tell you at first blush that there's something very wrong with this process, even after 1803 came into effect. We were the first case saw heard back in early 2012, and they found we had not committed any fraud, waste, or abuse in our billings. That ruling was finalized in early 2013 by the HHSC judge, who coincidentally retired shortly after that ruling. Despite this success at SOA, unfortunately, we have not had any relief with Senate Bill 1803. In fact, it is worse. Let me tell you why. As a result of the decision, we expected a return of some $1.3 million that were being held. We have expenses, we have staff, we have spent over $400,000 in the SOA process. HHSC refused to return it. We went before a Travis County judge who agreed with us that it should be returned and ordered HHSC to do so. They still refused. There needs to be a provision created in the next legislative session where if a provider is found innocent, the funds should immediately be returned to the provider. It's now been 3 years and we still do not have our funds. Apparently, because of our success at SOA, HHSC then launched a further investigation into our regular dental billings. This investigation is apparently still ongoing. Recently, I got calls from several former employees that said lawyers from the states were calling them and asking them if we incited to commit fraud. There needs to be some provision with a new due process bill to protect providers from investigations that are harassing and creating retribution. Also, HHSC has an overpayment recoupment claim against us. Senate Bill 1803 is very explicit to docket a case on an overpayment hearing with SOA if requested for the provider. We have made that request. But even this occurred after the effective date of Senate Bill 1803, HHSC docketed our case with HHSC judge claiming that the overpayment claim was somehow made before Senate Bill 1803 went into effect. This is directly contrary to the clear intention of the legislative session and Bill 1803. And we should make it clear to HHSC that SB 1803 means what it says. As you can see, 1803 was a good start, but a lot of work will be done next session to create a level playing field that includes due process and allows healthcare providers in Texas to remain in practice to serve the needy population of our state. You know, our practice has now gone through 3 years of trying to settle the situation, and it's still ongoing. And I know one of the questions that comes up, you know, from legislators is, why is it taking so long? Well, if somebody's innocent and you're still trying to find something, it can take pretty long. And we feel we're innocent. Thank you.
Thank you, Doctor. You know, obviously, what you've laid out, I can't imagine any member is in favor of you know, something like that happening or continuing. And so I hope that we can address this. That's all I can say. You know, if you did wrong, we want to get you. If you didn't, you know, we just got to do something to change the system. Members, any questions? Thank you.
Thank you.